Now for the 5-step EKG interpretation. The first step is the heart rate. Normal is between 60 to 100 beats per minute. Anything too fast is tachycardia, anything too slow is bradycardia. Next is the rhythm. Regular means regularly spaced choo-choo trains, or basically the R peaks are regularly spaced. Anything outside of that is basically an arrhythmia. Third, we have the P wave. Remember, the P lump means the atria pump, so it should be present and upright and married to a QRS. This completes our little choo-choo train. So with atrial problems like atrial fibrillation or atrial flutter, we have a P wave problem. Fourth is the PR interval. So PR basically is the time between the atria contracting and the ventricles contracting. So if we have a PR interval problem, well, this means we have an atria and ventricular communication problem. So we have to look for anything over 5 small squares. Now, lastly is our QRS. The QRS is the ventricles pumping. So it should be normal and upright, and it should be less than 3 small squares, or basically 0.12 seconds. Let's walk through a 5-step EKG interpretation. Step number 1 is the heart rate. Normal sinus rhythm is a heart rate between 60 to 100 beats per minute. Now, how do you find this out? So you have to count the peaks here, and we have 8 peaks in this 10-second strip. So 8 times 10 is 80 beats per minute. Step number 2 is the rhythm. We have to make sure we have evenly spaced R peaks. Now, to do this, you simply get a piece of paper and you draw 2 dots and you just march it out to see if they're evenly spaced apart. So this makes sure we have even distribution of oxygen with every pump to the body. Step number 3 is the P wave. Remember, with the P pump, this is the atrial lump, and it should be married to the QRS, basically the ventricles pumping. Step number 4 is the PR interval. This basically measures the time between the atria contracting and the ventricles contracting. So if the PR interval gets way too long, like over 5 mini boxes, well, then we have some type of blockage in the heart. Step number 5 is the QRS. These are the big mama ventricles contracting. The question you have to ask, is it present, upright, and is it tight? So remember, the QRS should not be wide. This would mean that the ventricles are having trouble contracting.